actually seen this ad. It's never just HIV. Okay, so the vast majority. That's good to know. So Daniel.
Hello everyone. Thanks for having me and us. So, first question here. So, what are effective HIV prevention messages that reach gay and bisexual men? So, social marketing has definitely been on the forefront for us at Black Men's Initiative, in part because we have the Mix, which is our empowerment project. We actually have some of the Mixins here representing, hey guys, and they have actually been working on creating a social marketing campaign. So they've actually taken their time, in part because of the seriousness and the lasting effect they want to have. So in looking at the social marketing campaigns that currently exist, like HIV Stops With Me, GMAD's anti-stigma campaign, I Heart My Boo, and seeing them, there's definitely positive messages that the Mixin have stated themselves they want to continue, that they want to project, that they want to make sure it's lasting out there for the HIV, for both HIV negative and HIV positive gay and bisexual men. In speaking about scare tactics, pretty much just reinforcing Oriol's point, scare tactics aren't really effective. Sure for the moment, but they're not effective when it comes to long-term behavioral change. And Harlem United, our stance is lifelong risk reduction. And scare tactics aren't the way to go about doing that. So we definitely have had some conversations and issues with the ads that currently are out. We've seen how should AIDS service organizations and government agencies involve community in the development of campaigns. That's interesting because one of the questions we had for our Mixins was, have you seen the ads? And a few of them actually haven't, which is interesting. And we've actually asked a few, how many of you have heard of the campaign or have seen the community being solicited for feedback around the campaign? And not one could answer, yes, I remember when they were doing focus groups for it, or I remember hearing fellow community members saying that Department of Health is reaching out to try and find out about this. So I think, if anything, this has certainly left me with more questions and just, questions. We definitely are curious as to how this came about, which we're going to discuss, who was involved, what community members provided this feedback, and hopefully we'll get some answers tonight.
Thank you very much, Daniel. And now we're going to hear from Tokes Osubu, who is the Executive Director of Gay Men of African Descent.
Thanks, Sean. Good evening. Fear-based campaigns around HIV. A lot of studies have actually been done that show that fear-based campaigns do actually work. Not only here in the United States, but certainly in the UK. And what those what the research shows is that fear-based campaigns work not necessarily to change behavior, but to arouse fear. But to arouse fear that makes people stop to think about what it is they're doing. And what has also been shown is that those who take notice or those who find those campaigns effective are those who probably already engaged in the behavior that you're looking to change. And we've actually found that in some of the work we're doing at GMAD, because as you rightly referred to, we do a lot of social marketing stuff at GMAD. And what part of that process is to conduct focus groups, to run them by the community. And what we found is the few occasions where we've done two groups, one a control group, which we call of negative, those who are negative, and those who are positive, you find or you get very, very distinctly different results. For those who are already HIV positive, like myself, I guess answer you want to say is that you should hit hard, you should be very, very graphic, you should be very clear as to what the consequences of being HIV positive is or are. And for those who are not positive, It's like, well, let's try to stop it, because the fear that you're putting out there basically just turns you off. You know, and because we're talking about sex, we're talking about behavior that folks are engaging in on a regular basis, and then feel is their right to do it. When you project fear, what we're finding is that a lot of people are tuning it out because they say it doesn't affect them, or it's not something that they need to take seriously, or because there's no one there to monitor what it is they're doing, they really don't take it seriously. So what we have to look at as a community is what is fear-based marketing or prevention. If we look at what actually triggered this forum today, the ad by the city of Harlem, when I first saw it, my impression wasn't that it was fear-based, and that's still my position today. So my initial reaction when I was asked, actually by the City Department of Health, to respond to it or to make a comment was that to say that it was fine, I thought it was effective. But before I actually did that, what I did was to run it by my staff, and with the exception of 2 people, everyone thought it was very effective. And my position today still remains that it speaks the truth about what living with HIV is, how difficult and problematic it is, and that whilst folks are not dying off like they were in the 80s, and if you think about it, the fact that you have your friends dropping off like flies, actually instills fear in many of us. So that, on some level, I guess it calls social marketing, even though it's not, it wasn't strategic. However, I still maintain that, or I still question those who criticize this particular campaign, because the truth is, for many who live with HIV, and I don't know how many are in this room, I certainly are, and it is very true for us that it's not just HIV, it's much, much bigger than that. And so those are some of the things I believe that we ought to be looking at, we ought to be talking about, and that we need to be very honest with what is going on in our community. Unfortunately, the epidemic has shifted. It's moved over from Chelsea to the outer boroughs, and we cannot, I don't believe, in all honesty, try to gloss it over and say it's just not, or it's something that you can just take a pill and it disappears. I personally don't believe that this particular ad or PSA is projecting fear. I think it's just the truth. There was an ad, or actually a campaign that the Department of Health put out a few years ago on, I think it was smoking or something. It was very graphic, and I thought it was very effective. I believe it was a smoking ad, and it was someone's face. Yeah. I actually personally thought it was very, very effective, and that's my personal opinion. But I also believe that a lot of people paid attention to that. In this work we're doing, I think we need to be very, very honest about what it is we're doing. It's not easy work, but at the same time, just going out into the communities to do outreach, and talking to people is not enough. Folks really need to see what it is, or how difficult it is living with HIV is, and what that there's a false sense of false sense that everything is okay once you just take those pills, because it really isn't that easy.
Thank you, Tokes. Now we're going to go down to the other end of the table to Les Pappas.
Hello. I started working in AIDS prevention at San Francisco AIDS Foundation in 1984, and then I started Better World Advertising in 1996. 1996 and we worked on a lot of social marketing campaigns here in New York with GMHC, with the AIDS Institute, with Harlem United, the Harm Reduction Coalition, Positive Health Project, kind of a fairly long list. We don't work with the health department, the city health department, and so I don't have I did not work on this project, and I don't have any particular agenda, around it. But I do want to talk a little bit about, these issues of fear and stigma, and I think that, they get tossed around a lot in a fairly simplistic way, and I think as some of the speakers have already indicated, this is a lot more complex than that. But stigma clearly is bad. It's unhealthy. It really doesn't contribute to what we're trying to do. Fear, on the other hand, reminds me of Wall Street. Greed is good. Fear is good. Fear can be good. And just for the heck of it, I looked up on Wikipedia the definition that they have for fear. I'm just going to read a couple of sentences. Fear is a distressing emotion aroused by a perceived threat. It is a basic survival mechanism occurring in response to a specific stimulus, such as pain or the threat of danger. In short, fear is the ability to recognize danger and flee from it or confront it, also known as the fight or flight response. There has been a lot of research about how fear works to motivate people, specifically around HIV prevention. I think that there's some agreement that it works best on people who are the most easily reached, and I think in that sense it's almost not necessary to use it because those folks are already kind of have their own reaction as long as they have the information, and they probably already respond without a lot of prompting. And over all these years that I've been working in HIV prevention, there certainly has been a general feeling that, in terms of HIV prevention in gay and bi men, that using fear just to scare people into changing their behavior probably doesn't lead to sustainable changes, and probably makes it harder for people to take in information. If the fear is excessive, it's less likely to have an impact, because fear generally, it puts us in a defensive mode. Right? We're scared, and we either prepare for this fight to defend ourselves, or we run away and want to deny or forget about the threat. But on the other hand, I don't believe in protecting people from information that might scare them. I do think that we need to be honest, and I do think that people need to fully understand the consequences of their actions so they can make better choices. And I do think that we've had people say, well, people are afraid of HIV, gay men are afraid of HIV. I'm not really buying that. I don't think they are, and I don't think that we certainly aren't in the way that we were when HIV first came up. But things have really changed a lot, and so I think that it's just really important to take on each project. And I obviously can't speak to